I'm here with Sami, who is a speech pathologist, and she's going to dive a little bit into things that parents should really be on the lookout in this rapidly growing field. So check it out.
My name is Sami. I'm an SLP, and I want to share with you some red flags that you can look out for if you are concerned about your child's speech and language skills. So let's get into it. Number one, I would be concerned if they're not meeting their developmental milestones. So what does that look like? Well, before the age of 1, they should be exhibiting pre-verbal skills. So gestures, sounds, and babbling. Around the age of 1, they should be starting to produce their first word. By age 2, they should be producing at least 50 words and combining words to form 2-word phrases. By age 3, they should be producing at least 200 words and combining words to form 3-word phrases. They should also be imitating everything you are saying and doing and starting to follow some simple 1 and 2-step directions correctly, like go get your shoes. Number 2 is if they are exhibiting anything atypical in their development. So that looks like a regression in skill, abnormal play skills. Are they lining up blocks instead of stacking blocks, or spinning wheels of a car instead of trying to race the car? Or abnormal social skills? Are they not making eye contact, responding to their name, engaging in joint attention, or turn taking, or parallel play? Here are 4 strategies that you can implement to possibly prevent some of those things from happening in the first place. Number 1, model language. So narrate everything that you're doing, be as specific as possible, label, use visual cues, repeat, prompt for imitation. Talk to them as much as you can because they're learning all of these new vocabulary words and basic language concepts from you. Number 2, teach them that communication is a tool. So if they know that, they understand the cause and effect that, okay, if I request, I'm going to get what I want, they're more likely to communicate. But you have to allow them the opportunity to begin with instead of just talking over them or handing them whatever it is that they want. So you can do this by offering choices. Do you want milk or do you want juice? Or you can ask a yes/no question, pause, see if they'll respond. If they don't, that's okay. That's a perfect opportunity to model the answer, but you want to give them the opportunity in case they do want to respond or they can communicate. So number 3 and number 4, limit processed foods and screen time because we know that both of those things are detrimental to our brain and our body, and we want to ensure that our children are in the best health possible so that way we can make sure that they're developing properly.